Are you guys doing Ancient Princess?
Good,
Oh,
good.
hello. Welcome.
Yes, yes. Princess, what's going on with you?
When it rains, it shines. When it shines, it rains. But as it goes on, you gotta still keep pushing.
Thank you for the promise. Okay, okay. Well, today we have Yareen here, and we're gonna have Yareen introduce herself, a little bit about her background, and then we're gonna introduce our topic and why we chose Yareen to be the one to talk about this topic. So, Yareen, just tell us who you are, maybe what your background is, and then we'll introduce the topic, and then we can talk a little bit more about like why you are the person to discuss this topic with us.
Okay, excellent. Thank you so much, first of all, ladies, for inviting me and having me share a little bit about myself. My name is, and I am here today. Hopefully, we won't go ahead and go too much into that because hopefully today we'll share all about that. But a little bit about me, I am a former researcher, instructor. I'm a mother, I'm a friend, I'm a traveler, and I'm a person who suffers from recently chronic pain.
Yes, yes. And I've
Welcome.
traveled plenty of places with Yareen. She's a great traveler.
Thank you.
Yes. Right. All right.
Yeah.
So before we get this topic, obviously, we just want to put this out here. If anybody is suffering from any type of chronic pain, we're not here to diagnose you. What your lead talks about, or if any of us talk about our chronic pain, we're not doctors, right? So make sure you talk to your own doctor about your chronic pain. We're just here to talk about like your lead's journey and maybe willing to talk about some of our own journey with our own. So just wanted to put that out there before we really get this topic discussed. But Doreen, before we get really started, are you comfortable talking about like, how you got diagnosed with chronic pain and any of your like medical conditions that kind of led to chronic pain?
Yes, it took me a long time to get comfortable and get into these shoes to be able to talk about my journey. But yes, today I am. I'm more comfortable talking about it and sharing with it because I truly believe that sharing about my journey hopefully will allow others to open up and want to be able to share about their journey. Because as you said initially, my journey is not one of another person's journey. But the thing about it is that what I have gone through has helped other people open up and advocate for themselves with their providers about getting help and more information about how to cope with their medical journey. So yes,
Mhm.
I am comfortable about sharing about that.
Okay. Well, I appreciate that. And anytime like you don't feel comfortable discussing anything, we can just move on. So the first question really is like, when did your chronic pain journey begin?
So the chronic pain journey started. It's really hard, but I'll go ahead and say probably about 5 years ago or 2021 it started, which is when I actually probably around about the time when I noticed that something was not right. So I'll probably say in about 2021 is when it started.
Hmm. Yeah.
Hmm.
And how would you describe that initial pain? Like, when did you notice, when you said that you noticed that something wasn't right, what wasn't right about that in 2021?
Okay. So what happened was I had what most women my age, I was about late 40s, and I had simple what they call just like a sore shoulder. And I had that for pretty much all of like 2021, starting probably like February, March of 2021. And I went in for what the orthopedic surgeon had just told me was going to be just a regular rotator cuff or just to repair my shoulder. So I went in, I had done physical therapy, et cetera, for that year, like most people do. And then I went in and I came out literally that day, and you're supposed to go to physical therapy to get like the normal 2 week, I guess, repair on the shoulder, so you shoulder arm, so you could go ahead and use it again, and then get back to your normal activity routine. Went into the physical therapist, and during that time, I think it was like 3 days after the surgery, physical therapist said, "Hold on, something's not right." I was home maybe like the day or two before the surgery, and I was saying to myself, like, all the things that they told me, it didn't line up with like how they told me the progress would be either. But I just kept pushing through the therapy. And finally, just one day, I said, in therapy, I said, hold on, something's not right. Like, I'm pushing through, I'm doing everything. I'm going to go ahead and make another appointment with the surgeon just to find out what's going on. The physical therapist said, well, let's go ahead and just try, maybe another week. And me, myself, I said, no, let's call it quits. Let's go back to the surgeon. And I did that. But at the same time, I myself said, let me call my primary care provider. So I advocated. And so maybe like within 2 weeks after the surgery, I just kind of knew something wasn't right.
You know,
Mm.
I think the
Yeah.
interesting thing what you said was you had to keep pushing through. Sometimes I feel like we don't even notice something's happening, but we're just like, okay, it's gonna get better, it's gonna get better. So for you to say that during, wow, like you just was
Yeah.
just tugging along. Wow.
you know.
Yeah,
Um,
I was, because I think when you're in the medical, when you're having any type of procedure, you're given instructions after.
mhm,
They give you written instructions of like, this is what's supposed to happen. And then they tell you, but if you have these different types of side effects, this is when you go ahead and you call, and then you call 911, or you come back to the hospital or the provider, or et cetera. And so when I was in physical therapy, the physical therapist said, was going over the papers, the discharge papers after surgery, was saying, like, you're not having XYZ. It didn't seem like the physical therapist was trying to rationalize with me that I wasn't having those severe symptoms enough to go back until that follow-up appointment that I had scheduled with the surgeon. So that's why in my mind, I was pushing through, because I didn't want to make myself out to be that type of patient that was just crying wolf, like I want to go ahead
mm,
and go to that follow-up
Right.
appointment. But at the same time, I wanted to advocate for myself. So I was walking a thin line of, when do you go ahead and do you say, like, okay, it's not one of these symptoms that's on this paper, but it's also something that just doesn't feel right.
right.
Mhm.
I wonder why we don't feel like we can trust ourselves, right? Well, we know our body best, right? And although the doctor
Mhm.
says that this is how it's supposed to go, here could be some possible side effects, or here's going to meet call 911, we still felt uncomfortable. Some just didn't feel right with you, but you still were juggling between like, I don't want to be like that patient that is constantly calling them and bothering, being a bothersome, but I also know that like I need to advocate for myself. And so why don't we worry about being a burden or being bothersome or calling what? Where I don't, where does that come from?
Correct. Correct. And the type of pain that I was having and the symptoms I was having, they were so when you look at didn't jump into head, when we look at my diagnosis, the type of pain that I was having pain that was excruciating. It was like, I can't even describe the level of pain that I was having. It was beyond the level of childbirth. I was
Yeah.
experiencing that type of
Oh
pain.
wow.
I mean, I was like, yes, the pain medication that I was given, it was even touching the level of pain that I was having. The symptoms were the symptoms I was having were not even on that sheet. So that sheet was irrelevant to me. And so they it was something that I didn't even know what to do with that. So the physical therapist was not a lot of the institute something that was not even on that list follow up. And very notice if the provider would not even helping me advocate for myself to say, like, you know what, let me go and be to the surgeon and say, as a provider, I'm not seeing these type of symptoms either in clinic. So,
All right.
okay,
Um,
okay, so
so Doreen, can you describe the pain that you were feeling after you had your surgery and you noticed that something wasn't right?
yeah, so the pain after the surgery, it was something that it was probably something like, so I've had a child before, and I had a child without an epidural. And so I had natural childbirth. It was pain beyond natural childbirth. And when I, jumping ahead, talking to providers that had diagnosed me, and we were talking about pain, and they were talking about levels of pain of the diagnosis that I did receive, they indicated that this type of pain is probably one of the worst types of pain that any human could actually endure. That's the level of pain. And pain medication that I was taking, you know, I could take pain medication and it literally did not work. It just would not work. So I would go to physical therapy. I was not it was not working. This pain was working on my physical, mental, emotional self. That's the type of pain that I was enduring, and I had no earthly idea where the pain was coming from. No one could tell me where it was coming from, and that was probably even more frustrating. Yeah.
I can only imagine when you said that that pain was more than you had natural childbirth. That's the so you already knew how your body feels with natural childbirth, and it's worse than that. Oh my goodness. Like, so can I ask a quick question, Mary, if it's okay? When you said mentally, like, how did it like feel? Like, were you alone in that journey mentally without that pain? Did you at least have people around you, you know, to try to help you out while you were in pain, or it's just you dealing with this?
So I had the type of person that I am, I had started just shutting people out because I had mentally started just like doubting myself because, when you have medical professionals telling you that, you have this list, like it should be this, 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 and in 2 weeks, you should be able to return to your prior field of work. And, so I'm counting down like on a calendar of being able to go back to work. But mentally, I'm fighting this saying, how can I possibly return to work when the level is so high? So I'm shutting people out because I don't want people to think that I'm this crazy person. Emotionally, I'm shutting down. So I had started shutting people out. Like this distrust for just like everyone had just started coming too. And so I just couldn't, I had started, me being a big social person, I had started shutting everyone out. Phone, no, I did not want to answer the telephone. I could barely sleep because the pain was so high. I did not want to go out anywhere because I could not dress myself. I could not maintain myself hygienically.
Wow.
I just I couldn't do anything to allow water to touch my body. It was so painful. I could not brush my hair. I couldn't brush my teeth. I could barely get up to go to the bathroom. I could not, like little things. I was very clean and organized. I couldn't like to get a cup and then wash it. I couldn't do those types of things. So the embarrassment started coming into fruition. There were so many things that started happening that, for someone to come over, oh no, it's like that kind of thing. Then for them to call and how are you doing? The thing is like the lies, and I'm not a person that likes to lie. So, instead of lying, you just go ahead and you just let me just ignore the person or persons.
Mm, man, just doing that alone. Oh my God.
So, Doreen, I think you're kind of starting to somewhat hint at like you did end up getting a diagnosis
Yes.
for what you were experiencing. And I think yes, no one really wants a diagnosis, but sometimes it can be really reassuring to like get a diagnosis, right? To know that like, no, you're not crazy, right? Like there is a reason for this. Other people have experienced it. There are doctors who not coral doctors who specialize, but yes, there's been research. So this thing does this. I'm not just, a big loser. I'm not going, this is not something that I've just created in my head, right? You know, what was that? What did you feel when you finally got the diagnosis?
So I felt like like Charlie Brown when I first got that diagnosis, because when I received the diagnosis, I thought I was going to have a diagnosis of something that I had heard of or that was fairly common in the medical community. However, I received a diagnosis of something that was very rare and unknown in the medical community. So I I got a diagnosis. I had a room of people. It was probably a very small room, and I had probably 25 or more medical professionals in that room, and just me. It was almost like a hot box. I thought I was going to faint that day when I received the diagnosis, because I have a very rare chronic disease. And so I was diagnosed. I had the surgery in August of 2021. Yes, I was happy that I did receive a diagnosis fairly quick, which was October of 2021, but it was complex regional pain syndrome, which is very rare. About 50,000 cases about are diagnosed each year, and about 200,000 people in the country, in the US, roughly have it each year. So it's very uncommon. And so for me, having a room of about 25 people, I felt like I had no idea. It was just like all this chatter. Like, "Wah, wah, wah." I didn't even know what was going on. No leaflet, no pamphlet. All I know is that the primary doctor just said, "You have it." And like all these other people are looking at me, etc. I met the criteria. They were like hands down. They were talking mostly amongst themselves because they were so super excited that they had somebody to have had that and had the privilege to see somebody with this diagnosis in front of them. And then as soon as they walked in that room, they walked right out. And the next person I encountered was like a CMA or a nurse to tell me, when do you want to schedule your next appointment? Like, like there's no pamphlet, like there's no other information for me, because the information around the diagnosis that I have is that rare that there's no pamphlet, there's no other information, there's nothing. So I just had people who just wanted to see somebody who had it. And they were just so in awe to see somebody and to see the symptoms and that met all of the criteria, that they walked in. And as soon as they walked in, they gave me that diagnosis. They looked at me, they poked and prodded as much as they could. They walked right out. And it was just like, your next appointment. And that's it. And just left me there in tears.
Well, that's not really one great. That's really matter. And like, especially in these teaching hospitals, right? Like, yes, that's probably what it was. They were like, oh my God, we haven't heard about this. Is so new. Let's go see this, rare person that has a disease like a circus, right? And
Yeah.
not really understanding and trying to understand like what this meant to you. Like what did this
The human
mean to
aspect.
like the human, like right? For you to what did this mean for you to have this rare condition, to have doctors who a lot of doctors who don't really understand it, and to try to at least link you with a provider, at least to give you something, right? Not just a diagnosis, but to say like, look, I don't know a lot of knowledge about this, but I know about these other researchers, about this clinic. Like here is some information where I want to link you to, so at least you can feel like I left with something other than a diagnosis and really a lot of unknown. Like, what does this thing mean? Like, where do I get help? Am I just going to have to live with this thing for the rest of my life? Like, this is excruciating thing. Yeah.
Mhm. Exactly.
Mm-hmm.
Exactly. Yeah. So, yeah. So that's kind of what I was happy to receive a diagnosis, but at the same time, I was very, very sad, very frustrated, very emotional. I really didn't know what to do with it. I was very confused. Yeah, I really didn't know what to do with it, because I wish I had known what it was, I guess, or maybe had a diagnosis that was more common, something I could just kind of look up and say like, oh, okay, here it is, and I have information at my fingertips, and I know which direction to go to, or there are specialty providers in my local area that could help me, but that's not exactly what it was at all. And so I was left, and it was just kind of like, okay, I have something, and that's all I have. I just have a name.
Yes. Okay, Doreen. So I have a question for you. How would you describe your pain to someone who has never had chronic pain? If you, outside of like a headache or childbirth, someone who's never experienced it before, how would you describe it? And is your pain consistent? Does it go in waves? What does a good day or a bad day look like for you?
Very good question too. Thank you. So the thing is, that chronic pain is chronic. It's not something that you have one day and you don't have the other day. It's something that exists with you all the time and it lives with you all the time. And that was something that I had to learn to live with as well. When I first was diagnosed, I wasn't used to that. I thought it was something that I was going to have, kind of like a headache, and then it was going to go away. But no, this is something that I have all the time. It's just a level of how you have the pain, of where how the pain exists within your body. So some days it may exist for me, like on my personal level, and I'll touch on what I mean about my personal level. It may exist on my personal level at a 4 today, but then like on my really bad days, it may exist like on my 7 or 8, or on my days where I just can't get out of bed and I can't do anything. And so it's very different than someone who has just a common cold, or just like stumps their toe or something like that. And so the the individual who has pain that's not chronic, the one thing that we need to differentiate and have understood is that people who have chronic pain is something that you continually live with. People who don't have chronic pain is something that you're going to get over. You're going to get it. It may last for a couple of days, or it could even last for maybe a couple of weeks, but you're eventually going to get over it. The person who lives with chronic pain, they don't. They just have levels that they tolerate. And so living with pain that's chronic that you tolerate, and you tolerate on your own individual level or scale, is one that's personal to that individual, because over time you learn to adjust and tune your own scale of tolerance. So as I've been on this journey, I've learned to adapt, not have this threshold. I used to, like I told you initially in this journey, it used to be like, I don't know, all the time. But I had to choose what I was going to do and how I was going to manage this lifelong journey. Was I going to go ahead and take prescription medication? Was I going to do alternative therapies? Like how was I going to manage it? And so as I've learned to adjust it, I've learned how to adjust my pain level tolerance also this journey as well. And so there are some days when um you know, barely functioning. I could barely walk. I've been a person who was in a wheelchair for a long time. And people, when they see that, they're like, oh my goodness, I can't believe you're in a wheelchair for like 2 years. And, and there's some days when I'm not walking. Um, but then there's other days, and I'm like always a positive person. I'm just like really smiling. Like, I would never know that you're in pain. Well, my outside doesn't reflect my inside. And that's the person in chronic pain. They really try very hard not to let the outside world know what's going on the inside. They hide and mask a lot. And we're really good maskers. We're very good at doing that. I do my very best to make sure that I don't have to let the outside world sympathize with me all the time. I don't want the outside world always feeling bad for me. I do what I can when I can. And I feel like a lot of chronic pain sufferers do the exact same thing that I can. If I can, I will. And if I can't, I won't. It's one of those juggling worlds of, um, I'd like to know in advance when something's going to happen because I may have to cancel. And if I do cancel, then it's like I have learned now to not live with those regrets because grief was a big part of my life early on. But now I'm better with saying, like, hey, I don't know when I'm going to have that bad day. And if I do have to, but I do a lot of living, no, I have to do this. And let me do as much as I can to minimize having like that bad pain day. So I can make it to that event that I actually want to make it to. So I minimize like putting myself um, into those um, into those moments that are going to cause my body a lot of stress. So I can't make it to those moments that I want to attend as much as I possibly can.
Yeah, thank you for that. Right. I think you started to talk a little bit about some of the things that you've had to learn or adapt to as you kind of go through this journey and um being a person who is just dealing with chronic pain. Right? What are some of the things I think you've learned about yourself, right? As you've been a chronic pain sufferer for so long.
Yes. So the one thing I had to learn is I had to learn how to say no more so than I had to say yes. That probably hurt hurt more along this journey because I was diagnosed in my late 40s, you know. um I never in a million years thought that this was going to happen. Never. I had been working. I had a daughter who had almost graduated college. I had plans for like, oh, wow, now she's almost graduating college. This is what I'm going to do. I had just started really trying to travel. I was the type of person that the only thing that was going to hold me back from a yes was my work schedule. So I was always a yes person. You would never catch me saying no unless it was because I had to work. I was always going to say yes. I was very adventurous, etc. Now, can't be that adventurous person because my chronic illness holds me back from adventure. I want so so my body it's more or less my body prevents me from being the adventurer more so than my mind. My mind wants to do everything and anything, but my body prevents me from doing those things. I my illness, and that's another thing I didn't mention before. With CRPS, short for chronic um complex regional pain syndrome. I didn't just get that, but I got a multitude of other related illnesses along with that. And so that's something that happens. You get all these other comorbid diseases with that. And I wasn't prepared for that. And I wasn't educated about that. And providers did not educate me about that as well. I just found that out as my journey went along. So I've racked up a host of other diagnosis along this 5 years as well. And so I've had to endure a lot. I've had a lot of surgeries these past 5 years. Things I wasn't, things I didn't know I was going to have. I didn't sign up for those things. So those things also, they slow you down on your journey of living also. You know, didn't mention, it's pricey, it's costly. So that adds up also along the way.
Right. Well, Kurt, I'm glad that you did bring up like financially strain that it put on you to have to try all these new medications and go to these procedures and then, be on, recovery and how that might affect you financially to go through these experiences that you did.
Yeah.
Yeah. So what has like your support system look like? Your community that have kind of helped you when you started, getting these diagnoses, having these surgeries. Like when you at home, I know you said that you at time would isolate, but having found a community to kind of help you cope with the diagnosis that the chronic pain and also the other diagnosis and those surgeries that you've had.
Yeah. So initially it was so I just had it was I didn't want anybody to know. So because I was, like I said, I was shutting everybody out, didn't want people to see what I look like. So my daughter, she was a big supporter because she was living at home. So she was helping. And I had a few select friends that truly were just like not going to take no for an answer. They were like, nope, we're not going to take no for an answer. We don't care. We'll leave messages, etc. We're just going to call. And, they are what I consider true friends because they are still friends today. But then I also, through therapy, because therapy was um, mental health therapy was a great way for me to start dealing with what was going on with me. My therapist, she encouraged me to reach out to communities that were that had support around my particular diagnosis. So she helped me find different local, which there are none, but any type of support groups around the country. So I joined online support groups. So I had two online support groups that I attended each month, and that was a very good way for me to have online support. And I felt like it was non-threatening, so I did that, and I continue to do that, and I feel like sharing my journey that avenue does help me because you have individuals who are just new to the diagnosis, who are in the same shoes that I was in before, trying to figure out, like, what do I do? What's happening? And sharing that process of like, okay, be an advocate for yourself. Don't give up when they're asking about these different medical routes that you've had, and just letting them know like what your experience was. I think those are great avenues to share with newly diagnosed individuals. So that I think that's great. And then also just the local community that I like, the medical providers that I've seen over the past 5 years, when they ask me to speak to other people that they know have been recently diagnosed, I don't mind doing that either. So I'll connect with different people, and it's only a handful here and there over the years that have been diagnosed, or it may be student groups who just have one page in their book, and like a student group may want to speak to somebody who has CRPS or CRPS in my different medical diagnoses. They want to speak to somebody, and I don't feel like a guinea pig. I feel like I'm really educating people because I'm educating them, and I'm telling them what it's like to have this particular diagnosis. Because honestly, you're not going to find somebody who has my diagnosis. This is something that they read one page out of their entire medical career. Like some doctors, they just read like maybe like one or two pages in their entire medical career about. They hardly ever see or encounter a patient. So I feel fine. I don't feel like I'm put on the spotlight. I feel like I'm really educating and I'm benefiting the medical community when I'm going into these medical groups or these seminars and educating people.
Well, that's good.
That's
You pass
good.
away to no. Go ahead, Aisha. I'm sorry.
No, and I would say that's good to know that you don't feel like, you're like a lab rat or something like that. You're, more like an educator. And we need that. You need
Mhm.
a spokesperson to advocate for not just yourself, for other people who can't put words to their chronic pain, to what they feel, because I'm pretty sure as soon as you open up and you say, they're like, oh, that's it. That's what I
Mhm.
feel. It kind of gives them more insight on how to handle it. So that's good.
Mhm.
Yeah.
Mhm.
That's great. And I definitely was going to say, as a person of color, you've seen the research out there, how, particularly like also women of color, right? How our pain is
Yes,
not taken as serious as other,
absolutely.
and so I think
Mhm.
for you to be able to go there and talk about your pain to like further like help educate the future doctors, right? So that they can have better bedside manner, that they won't be biased when you're treating, all people, but especially like, people of color and women of color, right? That
Yes,
they can take our pain as serious and don't dismiss it, right?
exactly. And that's one thing that I really do touch upon, especially when I have had hospital encounters, because I think sometimes providers do dismiss people of color because they have this preconceived notion of what people of color automatically want versus what the need is. And, during my hospital encounters, you know, you have medical professionals, and the first thing that they say to me is, "Oh, you're so well versed. You know exactly how to talk about your pain. You know exactly how to advocate for yourself." And it's taken me years to go ahead and get to the point of knowing exactly how to articulate my pain and how to use the correct words about my pain. But the thing about it is, I had help, and I'm thankful I had help. My primary care provider, I give her a lot of credit. She stepped in early on for me, early on. I when I had this, when I started in on the journey, and I recall when I told you I first got diagnosed, and I had that room of over about 25 people, and I left, and there were about 2 months there where I was just like lost. I didn't know what to do. And I'm sitting here thinking like, oh, I have this diagnosis, but I could still go back to work. I didn't know what was going on. And so finally, I was just going back and forth and I was being tossed around and people were mistreating me. I'm just trying to just do any and everything medically to me. And I didn't realize it. I just, oh, you need this, you need that. And I was getting everything under the sun done to me medically. I did not know. But then my primary care provider, she stepped in because I went into her office and I was just in tears. She sat with me probably about 4 hours and she talked to me. 4 hours of her time canceling other patients to talk to me and tell me and advocate for me about what I needed to do.
Wow.
And had it not been for her and at each of these appointments that I've had with her subsequently over the years, to check in with me and make sure things are okay, and make sure things are okay when I go to these other providers. And if a provider is not treating me well, for her to step in and advocate for me, I would not know how to voice these concerns I have, or to talk with these other providers, or to articulate as these providers say when I'm in these appointments, or to say when somebody's doing something to say, "Oh no, 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 I can't have that." Or no, 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 this right here, pause this until we could go ahead and figure out why it's a contradiction to something else. You don't have individuals saying those types of things where they're in an inpatient setting or they're in an outpatient setting. And then at the drop of a dime, messaging your primary care provider and say, I'm here and I have these providers on call on my chart and they're administering this, but I believe that there's some kind of contradiction to this particular diagnosis, and your primary care provider stepping in and they really want to make sure that you're okay. And so I have that support from my primary care provider to make sure me as an individual and as a patient, I am thriving. And I would not be here if I did not have that medical support from a primary care provider to make sure that my well-being as a person medically and physically, that I'm okay. So
Mhm.
yeah, so I've had that. A lot of individuals and people of color don't have that and don't know how to advocate, but she does make sure that I advocate and I use the correct wording.
Yeah,
Mhm.
right. Well, thank you, like, Dory, for, definitely being open and on the board with me to talk about like your chronic pain journey. I think, there's a lot of people out there that are dealing with, whether it's chronic pain, but are dealing with some symptoms or dealing with something that they just don't know. And they don't know how to
Okay.
advocate for themselves. They don't know how to express this to their provider. They've probably already talked to their doctor and they felt like they've been dismissed, but they're still suffering. So I think this conversation has been really helpful for like a bunch of people who are going through similar journeys or just even just an unknown, like, symptom that they're just experiencing, and it's been, definitely impairing their ability to function in life and then develop in their physical health.